just completed a CHROME guided smile surgery. It was Dr. Straka's first full CHROME, but not working with our metal guides. And on the right is Dr. Conroy, who is Dr. Straka's referral. And maybe just briefly, Dr. Straka, how did today go with CHROME?
Using the surgical guides really as it was worked out with our lab tech, Joe Ambrose, and virtually planning the case, it really went, as I could see, as planned. And using the guides are user-friendly. It's predictable. You have a lot of trust in the plan with the guides. Every step of the way is kind of back-checked. Guides are easy to use, easy to handle. I thought it just gives you more confidence during the surgery that the final product, the position of the implants, will be very close, if not right on target, to where you had planned them virtually.
And then as a team, the surgery stopped with implants for Dr. Straka, and then Dr. Conroy put the abutments in temp cylinders and took over from there. How did that process go?
Very, very smooth. The alignment was right on key, and no issues putting them in. Everything went really smooth. So it was alignment was just how it was planned, which made the whole job easier for everybody.
Great, excellent. And then this was our first C2F surgical system that we documented. And the nice thing is that the patient went home with very small holes in the prosthetic, and we now have a master model to make a final. We have a rapid appliance as a backup, and then the prosthetic conversion will be simple, right? You'll just simply send us the patient's prosthetic.
Exactly, yeah, everything lines up. It's almost like having a duplicate, perfect, that fits exactly how it should. So take one out, put the other one in, send it to you. We should have a final prosthesis very smoothly.
Yeah, I think CHROME GuidedSMILE will work out fine, this surgery. Okay, thank you very much.
Yeah.
Thank you.